And today on Wellness Central, we shine our eyes, literally. We're shining a spotlight on one of the most critical aspects of our health, and that's our sight. Now, it's often said that the eyes are the windows to the soul, yet in Nigeria, we tend to neglect the eye health in our everyday lives, whether it's skipping regular checkups, if at all we do have checkups, or ignoring early warning signs of vision problems, or underestimating the importance of preventive eye care. Well, sight health remains low on our people's list of priorities, and I dare say that I took it a bit nonchalantly until it was too late myself. But sight is a gift, and protecting it is crucial. And according to health experts, millions of Nigerians are at risk of preventable blindness and other eye diseases, which is why today, on World Sight Day, celebrating it throughout the week, we're taking a step toward raising awareness and encouraging people to be proactive about their eye health. For cataracts to glaucoma and diabetes, rhinopathy, Nigeria faces significant challenges when it comes to eye health. So how can we change the way we think about our eyes, and what steps can we take to ensure a future where fewer people suffer from vision impairment?
Well, to answer these questions and more, joining us here in the studio, we have very esteemed guests, starting with Dr. Efosa Airen. He is the coordinator, NOA Ikeja Zonal, and he'll be discussing the role of the National Orientation Agency in promoting eye care. We also have with us in the studio Dr. Nkechi Ugboh. She's the Deputy Zonal Coordinator, NOA Ikeja Zone, who will also provide insight on early detection as well as treatment and the cultural factors affecting eye health awareness in Nigeria. So, ladies and gentlemen,
Doctors,
welcome to the program.
welcome.
Thank you so much for joining us.
Thank you for having us.
First of all, World Sight Day. First of all, what does it mean for Nigeria, especially when it comes to raising awareness about the eyes? Because, just shared his own personal experience. I, for one, also didn't, I thought I was seeing 20/20 until one day I was supposed to attend some training, and then I was sitting at the back, and the whole time I just couldn't pay attention because I couldn't see. And then the next time I came into to come for the following day, I sat down for it. I'm like, oh my goodness, I can see better now. What was going on? And then the instructor said, I think you should get your eye tested. And I said, oh, I can see 20/20. She said, I also said the same thing, go check. And then I did. Turns out I cannot see you. It was blurry, the entire thing. It made perfect sense. But yeah, I wear glasses, but I've seen enough of Nigeria. So that's why I don't wear glasses. I see enough of Nigeria. So, but anyway, why is that? Tell us what World Sight Day would mean for us Nigerians when it comes to raising awareness. And I'll start with the lady first.
Thank you for having us. World Sight Day is an event that was being orchestrated by Lions Club sometime in the year 2000. Just to promote eye health amongst populations in the world generally. However, it was integrated into Vision 2020, and currently it's been run by IAPB, which is International Agency for Blindness Prevention, in collaboration with World Health Organization to promote eye health and create awareness globally amongst people. And this has come to stay. Like in the past 4 years, we've actually been clamoring for you loving your eyes. And this year, we are entirely and totally focused on children eye health, because we notice that children are one of the most neglected among society. Sometimes maybe because parents believe that it's peer pressure for them to want to check their eyes, but it's actually an error, And so we're actually clamoring for parents to pay attention to their children's health and check their eyes at least once every year.
Dr. Efosa, when it comes to awareness and eyesight and eye health, what are some common problems that is among Nigerians, especially with children, giving their children as the focus for this year?
Okay, like she rightly said, the World Sight Day started in the year 2000 with the Lions Club. Children, basically, if you look at the history, the leading cause of blindness is refractive error, closely followed by cataracts. So what we are trying to do as optometrists and eye practitioners is to see how we can create awareness with all those different conditions. Refractive error is basically short-sighted, long-sighted, and astigmatic. patients having issues seeing afar, patients having issues reading and all that. But all these things, there's no way you would know without having a comprehensive eye examination. So if you have a child that has the habit of moving close to the TV, or if you're a teacher and then the child is sitting at the back, he or she can't see the board, you need to draw you need to draw the attention of the parents so something can be done so that this child can be examined. So basically, the two leading causes of blindness right now in the world is refractive error and cataract. Cataract is simply put opacity of the lens. Initially, we say, oh, cataract is a disease of the old age. But these days, you have congenital cataract. Children are born with cataracts. Wow. And there are so many different types of cataracts. It could be traumatic also. Wow. But the good thing about this condition is that they are reversible. Wow. So we need to see these patients on time so we can attend to these conditions when they present.
Wow. The story you told is actually the story of my life from this week, because my daughter comes back home and says the teacher said to tell me that she can't see from back of the class. I'm like, you can't see. No, don't start now, was what I said. So apparently, I'm part of the problem in Nigeria. My entire family, we all use glasses growing up, and I neglected using them until much later, much well into my 30s. Now, what effect does that have on the eye? I am long-sighted, long-sighted,
no.
and I didn't think that it was a problem. I mean, I could manage well until back at where we used to work. It took me out for an entire month, and I didn't know exactly what was causing all the headaches, eye redness,
tension,
backache,
all the way to your ears.
And went to the doctor. Doctor says it's your eyes. I'm like, backache, eye, which one now? What's it concern? And overload, you know. But it was my eyes causing backache.
Yeah.
So how can neglect make the situation, or if you can give a timeline to blindness, how can neglect make the situation?
You know, like we say, early intervention and early detection is key. So sometimes, like you said, in Nigeria, there's just this stigma to the use of glasses. People just think, oh, you can't wear glasses, because you feel that when you wear glasses, some among the children, you have them calling themselves names like Four Eyes, you know, things like that, and as if they're blind. But checking your eyes is not just all about glasses. So we are actually advocating that parents should bring their children for eye check. The best time for a child to be tested is at birth, because there are various at birth, there are various conditions that could affect that child. Some of them are congenital. One of such could be amongst preterm babies. Preterm babies, like we have a retinopathy of prematurity. So at birth, the child is tested at 6 months, 1 year, 3 years, pre-kindergarten or pre-elementary school, and every year. So we're actually asking parents that as you prepare for back to school for your child, you should also take that child to test their eyes. Eye check, it will be amongst your checklist for back to school, for the children. And when the children comes and they tell you, my teacher says I can see, please do not doubt them. Yeah. It's important for them to come check their eyes. Now, he asked a very key question. At what time can you prevent this? What is the time range to the point where blindness can occur? There are some conditions in the eye, like you have a child that has a squint, one eye turning the other, and a lazy eye, and nothing is being done. At a certain age, that can be corrected. But when it's gone past the age of 9, it could be difficult.
Really?
Yeah, so you have something like amblyopia set in, where the eye just gets used to seeing a certain way. So it has actually affected the developmental process of that child. So
and also the quality of life.
And also, yes, very important, the quality of life, cognitive, social life. You see these children withdrawn, to themselves, because they really can see, and what you don't have, you don't miss. So they feel that most other children see that way, and that can be a problem for their success in future.
I wonder about, our present modern day and how environmental factors have influenced, the health of our eyes.
How is Nigeria affected?
I mean,
call it what it is.
But most importantly, when I talk about modern day, I mean, our appliances, our televisions, and even the tab. I mean, my niece and my siblings, their offsprings, when you see them, half the time they're like this. And I don't know if it's me as well, because half the time I'm also like this on, looking at things. But with my own, I'm going to use my as example, my own eye issue it was first of all short-sightedness, and then astigmatism played into it repeatedly. And I just kept overlooking it until when the doctor said, well, look, we have to get you these glasses. And the glasses, the frames that are getting thicker and thicker, and it's, you know. So let's speak on environmental factors, but most importantly, the use of appliances and the effect on our eyesight. But I'm going to continue, Doctor.
I'll take it from there. The current world has become a visual world. So everything you do now is basically with your sight.
Yeah.
We can be here and then having meetings with different people from all over the world.
Yes. Yeah.
This is done with your sight. And how do you do that? Electronic gadgets. This is even made difficult by the advent of COVID. When COVID came, it locked us up.
Yes.
So everything became a visual thing. When you look at your tabs, your phones, your laptops, and all that, there's a ray coming out of the screen. With each level of development comes its own issues. Okay, the rays coming from the screen, they go hit your eyeballs and they give you issues. There is a spike in the level of dryness in the eye. Those days we say, oh, dryness basically was that for the elderly people. So when we say the eyes are dry, we say the eye is not secreting enough tears, or the tear film is not slimy enough to lubricate the eye. But if you have your eyes exposed to these gadgets, the tear film tends to evaporate faster. So dry eye has become a major issue with our children because of our vocation. In this kind of environment that you are, with light everywhere.
Ooh.
So I can imagine what you guys go through on a daily. So your eyes basically should be dry.
There was a time I was supposed to do something, and I woke up, I had this, one of the eye had been swollen because it was so dry. I said to itchy. If you had seen me, you'd think maybe I was in some fight, and they, you know, gave me some serious blow in both eyes, and they were red. And so I had to use the eye drop, and I literally had to take 2 or 3 hour nap.
I knew she was going to say that. You mentioned a buzzword there, eye drop. Go on, doctor.
This is how it is. We need to be guided when it comes to eye drops.
Yeah, well, that was prescribed.
Very important.
Prescribed, I like the word.
Yeah.
There are so many different brands and so many different medications, and quackery is a major issue. So I'll try and elaborate on the tear film. It is actually made up of 3 different layers. There's a layer that contains water, there's a layer that contains the nutrients, and there's the layer that holds the layers together, the oily layer. Okay, but for the younger people, the layer that contains water because of exposure to gadgets tends to evaporate a lot faster.
Right.
But for the elderly, the oily layer tends to lose viscosity. If I'm describing it to my patients, I use this car engine oil. If you get a fresh engine oil and just dip your hand inside, you bring out your hand, the oil is viscous, it's slimy.
Yes.
But with age, it loses that ability, becomes watery. You understand? So when you want to get eye drops, please make sure they are prescribed. And let's not be deceived. You may have other issues added to the dry eye. You could have allergy. So it's a combination of allergic condition and dry eyes. And then you mentioned the myopia and the astigmatic components. All these things, they work together. But each of these conditions will have to be addressed independently. A patient may have 2, 3 different conditions, but you take them the way they present. You understand? So if you want to get your eye drops, please make sure you get the eye drop from the right source.
Now, we're pressed for time, but very quickly, NOA here, raising awareness. What would be your call to Nigerians, especially parents and want to be parents like myself listening? Because, you know, pay attention.
What we are saying to parents and to Nigerians at large is we should prioritize our eye health. Eye health is not an option. It is very, very vital. And the future of our great country depends on our youngest generation. So we should ensure their eyes are tested and they are able to appreciate their environment and achieve their greatest goal in life, which they cannot be able to do if their sight is compromised. So please, we are calling on parents, stop sight practicing with your children. What I mean by that is stop taking these children to quacks. For some of us, we have some parents who just instill anything in the eyes of their children. Child says, Mom, my eyes are having issues, and they see the mother putting onions. You know, some as bad as instilling acid water, engine oil,
I'm sorry,
tomatoes, water.
It's bad.
It is
very bad.
I grew up
and these
with
children
onions
could show up
under
in
my
the
eye bags. I mean, you know, like.
And these children could show up in the clinic with scarred cornea.
Mommy.
And that is a very, very serious issue, because here we're talking about maybe if it affects the visual pathway, then we're talking about a corneal transplant. So
it's not a cure for annual conjunctivitis.
Stop doing self-medication. bring these children to the clinic and let them be assessed, let them be examined by eye care specialists, you know. And we're also calling on the government to, as much as possible, promote eye health and eye awareness, especially in the rural areas. You'll be amazed at the kind of disease we see in the rural areas and hard, difficult to reach areas, you know, inner city areas. Serious eye conditions that these children, they've come up with. And there is no access to health care. So we are asking them to promote health care, make health care affordable. We think we are happy for the new NHIS scheme that has come up, but we need to see more results. We need to see the impact of this in the lives of our future generation and the lives of Nigeria at large. So all the eye cares, we're asking them to promote eye care in the primary health care centers. We have them all over the place. We need to have more optometrists come up. We need to have more optometrists employed in the eye care sector in Nigeria. Thank you very much.
Dr. Efosa, you reacted when I asked if it isn't a cure for the very common ailment we see at certain times of the year, annual conjunctivitis. Apollo, yes, that's what they call it.
Apollo is simply a viral infection. So, but there's this misconception about conjunctivitis. The conjunctiva is about 3 different layers. So sometimes a patient comes in and then you look at the eye. From a layman's perspective, the eye is white, it's not red, it's not inflamed. When we say red, inflamed. But by the time you pull the lid downward, there's a bulb, there's a furnace under. That may be red, that may be inflamed. So, oh, this patient has a conjunctivitis. Not the red, not this white part that you see, but beneath it, okay? There's conjunctivitis. Well, now you need to classify them into the different types of conjunctivitis. Apollo, like I said before, is a viral infection. Some people call it the pink eye. There are other conjunctivitis. There's a bacterial conjunctivitis, there's allergic conjunctivitis, and there's a venous conjunctivitis. The allergic conjunctivitis and the venous conjunctivitis are basically the same, just that the venous is an improved form of conjunctivitis as against the allergy. Allergy simply means reacting to something. The venous, like I said, is a viral, and then the bacteria is a bacterial infection. So if you have conjunctivitis, we need to know which type of conjunctivitis do you have. The viral conjunctivitis ordinarily should run its course after 2 weeks. It should resolve. But if in case of management, after 2-3 days, if it doesn't resolve, then you need to see a doctor.
Okay. Dr. Efosa, that's a very, very good suggestion. Thank you very much. Please note, clarify with your doctor exactly which one it is before you go into your personal treatment. And onions are bad, according to Dr. Ugboh.
No, onions, I didn't say onions are bad. Instilling onions in the eye of the child.
Onions in your eye are bad. You can eat it.
Self-medication until it is prescribed. Until it's
Yeah.
prescribed, any self-medication is bad. We've been talking about World Sight Day and the importance of getting your eye checked, regular checkups, and some very common issues or common problems that we see with our eyes, especially for parents. If your child has an issue, if they're standing close to television, if they complain they cannot see at the back of the class, or you notice that their notes are never complete. 9 times out of 10, it's most likely because they cannot see. Or they're missing letters, or is incomplete. It's because they cannot see. I know, I'm short-sighted. Take them. Go to the doctors and get them tested.
And
again,
one more thing.
Yes.
The Nigeria Optometric Association Lagos State chapter, most of the clinics in Lagos State are open for free eye tests in celebration of World Sight Day. Okay. This has been on from Monday this week and even up till today, and some clinics will also be opening to next week. So the children can go for their free comprehensive eye examination, at least to know where the problem is and to start.
Thank you for that.
And then the key word, each time you go to these clinics, tell them you are for the World Sight Day. And kids, not adults.
Kids. There you go.
Free
not adults.
eye examination for kids.
Dr. Efosa, Airen, thank you so much for coming on. NOA Ikeja Zonal Coordinator. Also with us is Dr. Nkechi Ugboh, also Deputy Zonal Coordinator for the NOA Ikeja Zone. Lady, gentlemen, thank you so much. This is where we close the curtain and wrap up today's installment of Breakfast Extra.
Thank you.
Thank you for having us.